pretty old new nurse.
It's our second career.
That's something I always wanted to do. You're never too old.
Okay.
Hi everyone, I'd like to welcome you to this presentation. I know that you guys are all new graduates and will soon be getting jobs at hospitals, and I just kind of wanted to draw a little bit of a scenario for you that when you are working at your new hospital, there's a very good chance that on your night shift or day shift that you're working, you will be called down urgently to the emergency department. And once you get there, you will most likely see a patient in a room that's going through a lot of respiratory distress, they're short of breath. The room might be a little chaotic. There might be other nurses in there, family, the physician, and most likely the physician will look at you as a therapist and ask you what you would like to do to help this patient who's experiencing this COPD exacerbation. And just in the midst of the chaos, you might be kind of tempted to suggest intubating the patient because you know that when you intubate, that's going to bring some immediate relief, and it's a good solution, good short-term solution to the problem. However, I'm going to tell you that's probably not the first thing that you should suggest to that physician or nurse. It would be to maybe try using a BiPAP machine. A BiPAP machine can almost be used in any circumstance and situation to really help that COPD patient. And in this training program, we will really just look at some of the key features of a BiPAP machine, when you should use it, when you maybe shouldn't use it, and just kind of how to use it properly and what it does for the patient and their body. So we're just going to go over 4 key points on how a BiPAP machine might help a patient with their work of breathing, when you wouldn't want to use it, and in general, just kind of some of the key features of a BiPAP machine. So in our first point, we will cover when would you not use a BiPAP machine. And that would be any patients with any facial fractures. So you get somebody in the emergency department, and if they have any fractures, that's something that you would want to stay away from because of course you don't want that pressure blowing on somebody's face or creating more facial trauma. Another reason why you might not want to use it is if it's somebody who has recently had like an esophageal surgery or some form of bypass or anything like that. Like if you have a patient who's having a COPD exacerbation but a week ago they had a bypass, wouldn't want to use it. We'd want to not provide that extra pressure to, of course, make sure that none of those stitches come apart. Patients with a lot of facial hair, that could sometimes be tricky because you're trying to apply that BiPAP machine and you're getting a huge leak. They're uncomfortable and you really can't get it fitting, and it just kind of creates more chaos in the room. And of course, our last point is patients who are claustrophobic. So as you can imagine, a COPD patient is already having an exacerbation, is already short of breath, and here you are putting a mask on their face. So that's just going to send them more into a panic attack. So if you know if it's a patient is screaming, no, I can't have anything on my face, please stop, that's a really good indication that this is not a good candidate. It's just going to freak them out more. The second key point I want to cover is what does a BiPAP machine actually do for the patient in the long term when we talk about hospital stay. So we all kind of know that when we intubate COPD patients, they're a lot harder to get off the ventilator. So we know that that automatically increases our hospital stay. It increases mortality. There's going to be a lot more sedatives on board. So in general, as soon as we intubate that patient, we already kind of know that roughly they will be in the hospital for an extended 2 weeks, as opposed to if we just went straight to a BiPAP machine to kind of help them get over that hump on during their COPD exacerbation. Another reason is it's a lot more comfortable for the patient. So we know that when you're intubated, again, it's very irritating to the trachea to have anything in there. When you can't breathe, you might have a gag reflex. It might kind of make a patient want to throw up, can maybe lead to some aspiration. So in general, it's very uncomfortable for a patient to be intubated as opposed to be on a BiPAP machine for some period of time. Really just helps relax their respiratory muscles so they're not working as hard. And it really just helps them overcome that overall work of breathing. And the last point I'd like to cover is that it really improves the patient's status. Of course, helps the patient eliminate that extra build of CO2 in their body, helps them once again just overcome that hump, and helps them kind of correct the pH levels in their body. So there's a lot of things that a BiPAP machine can do that a ventilator can do. But of course, with a BiPAP machine, it's all non-invasive. So we can kind of help restore the patient's body back to their baseline without actually having to put in a breathing tube. And again, just helps really decrease the anxiety of that patient, helps them relax. Every time they take a breath, they'll actually be able to take a bigger breath because we'll be providing those inspiratory and expiratory pressures. So it kind of really helps stent their lungs open and helps them overcome that work of breathing. And lastly, of course, we know that COPD patients have trouble oxygenating. So a BiPAP machine is really going to help, again, open up those alveoli and help their body oxygenate better. So I'm just going to see if anybody kind of has any general questions, and then I'll ask you guys a couple questions and see where we are in our understanding. Any questions?
So the COPD patient whose CO2, it's
Is
been long standing.
Yeah.
So you're just returning it to their normal long-standing high baseline?
Yeah.
Okay.
Because a lot of times when that CO2 climbs higher and higher,
Yeah.
they just keep draining down.
Okay.
So we just want to get it back down to their normal levels and then kind of take it from there.
Okay.
Any other questions?
Oh, I have another one then.
Okay.
The COPD patients, they are already their alveoli are already big open.
Yeah.
How do you
Well,
recruit more that?
Well,
has
they're
no more to
kind of more
recruit?
like emphysema alveoli, so they're just really floppy, and they're really just having a hard time getting their body oxygenated because they're really having a hard time getting that air out. So when you just kind of provide that pressure,
helps
you're
that
just
trapping.
and you're just
Okay.
kind of helping them overcome that work of breathing that they have to try so hard to get that air out, and they can't because their alveoli are so floppy.
Oh, okay. All right.
So then I have a question for you guys. When would you not want to use a BiPAP machine?
If you have somebody that's super anxious and already concerned about, they're having trouble breathing and everything, and they're just really anxious about it, and you try to put something on their face and that makes them even more anxious and scared, that would probably not be a good fit for them.
Yep, absolutely. When else would you not want to use it?
Facial,
Go ahead.
facial injuries or a previous surgery.
Yep. When would you want to use it? On what kind of patient?
Someone you want to avoid intubating?
Yes. Perfect. Okay. Now we'll kind of move on, and we'll just go over just some of the different BiPAPs on the market. This one here is, of course, mostly touch screen. If we would turn it on, a lot of them you actually have to dial in, so you're